Hello everyone and welcome back to my channel. My name is Ijoma Kehenya. So as you know, in my last video I talked about how my husband and I have decided to make an addition to our family, and we are gonna use our frozen embryo to pretty much do that transfer and hope and pray that it works out for the next baby. And it's gonna be happening pretty soon, so we pray as long as nothing goes wrong. This whole pandemic situation going on, as you know, have completely changed the way we move in the world, and it have changed the way the medical industry deliver treatment, and there's no exception to like the fertility clinic I will be using, you know. So today's video I'll be talking about how it have changed quite a bit. Like for example, I have to go receive treatment by myself. Usually I go with my husband. So now, just to reduce the risk of me transmitting or getting the disease, just to reduce risks for me and everybody else around there, because you know it's not only me getting treatment. I have to go by myself to receive treatment, and I have to pretty much tell them if I have traveled or if I have exposed myself to. I have to pretty much follow the same kind of like quarantine everybody else do if they have traveled or exposed themselves, which is 14 days kind of like quarantine. And of course the excessive washing of your hands, and frequently and thorough washing hands. And of course, one of the things that I thought was really actually important is the fact that one of the procedure is pretty much to keep myself self-quarantined. This is what is recommended. It's to keep myself self-quarantined, just to make sure that I don't expose myself. And the reason why they recommend this is like they pretty much saying that do not expose yourself to other people like unnecessarily. If it's not a serious issue, if you don't have to go out and meet other people and expose yourself to like a possible COVID-19 situation, just try not to go. Anyways, and the reason for this is because if you happen to find yourself in that situation, they're gonna cancel your treatment and you will have to wait for the next cycle to like start your treatment again, which really suck. And they even actually try to say that if you're going through IVF, if you're starting your IVF from scratch, if you're going through a new cycle of IVF, you should probably self quarantine yourself and your family, because you are putting in a lot of time, you are putting in a lot of money, and you do not want to put yourself in a situation where you have to cancel your treatment and start all over again. So anyways, these are some of the reasons why you have to pretty much follow all the procedures, because if it's not even only your treatment that will be canceled, other people who are also getting treatment can be cancelled, and the clinic can be temporarily closed. They can close the clinic temporarily until they clear the threat issue. So it's really important that you or I follow all these procedures, not only for myself, for other people around you, you know. So, and then another thing they talked about is pretty much they're gonna be actually 24 hours before I get there, they are gonna go put me through a questionnaire screening to kind of determine whether or not I have exposed myself or I am sick or anything. Because if you are sick, you are pretty much told to stay home and not even come for treatment or anything. So the screening just involved me having to like answer a whole bunch of questions so they can determine whether or not if I expose myself or anything. So I will have to go through that 24 hours before I get to the clinic, and I will have to kind of like go through the same question again once I get there. So they will take my temperature, of course, too. So these are some of the 10 we talked about. You are expected to disclose if you suspect that you have any kind of symptoms of COVID-19. And the whole reason for this is because you do not want your treatment to be cancelled. I think I talked about a little bit. You do not want other people who are getting treatment in the same fertility clinic treatment to be cancelled. You don't want even the clinic itself to close. So it's important that you are responsible not only for yourself and for other people who are around you. Of course, the whole social distancing thing with somebody who is non-household member, so like 2 meters social distancing, and also when you get there, they're gonna of course have you wash your hands and use alcohol to sanitize yourself when you get there. It's pretty much what is expected of you, if when you get there. But like I'm not sure how I'm gonna stop touching my face, because they really expect you not to touch your face. They advise you not to touch your face excessively. So that's kind of like one of the issues that I am working right now to make sure that I stop touching my face, because it's a habit that I kind of do a lot. So I'm gonna try really hard not to do that. But anyways, guys, that's pretty much what is expected of me with regard to COVID-19. It really changed quite a bit about how the whole fertility work, and like I'm kind of like, yeah, it's completely different. But it's nothing that is not doable, of course. So, and but that's it for today. I hope this helps somebody out there, and I hope that everybody is keeping themselves safe and remain blessed and have a good week. Again, if you haven't subscribed yet, subscribe to my channel, please, and hit that notification button and hit like, comment, and I'll talk to you next time. Bye now.